Hi everyone, welcome to this edition of Leading Experts. I'm Grayson Foster. Coming up on the show today, I'll be speaking with a cosmetic and general dentist, Dr. Alan Nazeri. Today, having a beautiful smile is certainly in the forefront of the media, and Dr. Nazeri will be here to show us some great before and after photos of his patients who've had smile makeovers, and also talk about some of the advances in the field of dentistry. Just to give you a little background on Dr. Nazeri, throughout nearly 20 years of his private practice, Dr. Nazeri has not only kept busy building one of the premier dental practices in the country, but also has found time to donate his expertise to doing pro bono dentistry, as well as to volunteer for the Red Cross after the 1999 earthquake that shook Turkey. Dr. Nazeri is a graduate of Creighton University School of Dentistry in Omaha, Nebraska. He also has completed intensive postgraduate training, both at the Las Vegas Institute, the premier postgraduate learning program for dentists, and UCSF Advanced Aesthetic Program in San Francisco. Dr. Nazeri is an active lecturer in the field of comprehensive and cosmetic dentistry, where he has trained over 400 dentists, both in the United States and internationally. Dr. Nazeri is the founder of Cornerstone Dentistry, a 5-star dental practice he's also been featured in several national magazines. Stay with us. Leading Experts will be right back.
Welcome to this edition of Leading Experts. Leading Experts is informative and exciting. Leading Experts interviews authors, speakers, and entrepreneurs in all areas of business, so you become a much more informed consumer.
Welcome back, everybody, to Leading Experts. I'm Grayson Foster. Joining me today is cosmetic dentist Dr. Alan Nazeri. Dr. Nazeri is a member of the American Academy of Cosmetic Dentistry and a graduate of the Las Vegas Institute. His practice, Cornerstone Dentistry, is certainly a 5-star dental practice by any standards, and he's here today to discuss many aspects of cosmetic and general dentistry. Dr. Nazeri, welcome to Leading Experts.
Thank you for having me.
Okay, I want to know first off, what does Cornerstone Dentistry mean to you, and what kinds of services are you providing to your patients?
Great. Cornerstone is a general dental practice. It's basically a brainchild of, after practicing roughly about 20 years, I wanted to found some type of a practice that does not involve a high volume of patients. And really our philosophy is about quality of care, not the quantity of patients seen in a given day. So I'm proud to say we have created one of the premier dental practices in the country, and as you know, we have been featured in many national media and local media and so forth. So it's something that I take to heart very sincerely, and I love the way we practice and the level of care we provide for every patient. So
it's really a concierge type practice that you've got.
Exactly. It's something that is missing from the medical field. You know, it's dentistry or medicine have lost touch with patients, and patients are being pretty much treated as really numbers rather than person. So Cornerstone has that feeling of a small town type of a doctor feeling, that the doctor knows the family, knows people and so forth, so on a personal level.
I want to talk about the charity work and pro bono work that you've been involved with. Tell me about that.
You know, it has been Cornerstone Dentistry belief system that we have to give back to our community, and every year we provide close to $75,000 worth of free bono dentistry or charity. We support many charities in our community and so forth. And, you know, myself and my team are just a vehicle that provide these services. It's really our existing patients that support our practice that allow us to do this kind of work for charities and people.
As you touched on earlier, you were just recently featured in this issue here of Dental Town magazine. How did that happen?
You know, our practice basically was something that was featured in a magazine because of things that we're doing are quite different than a normal standard practice. And, you know, it was a way to confirm our belief that, you know, what we're doing is something different, it's something that a lot of other dentists are looking to do, and our they featured about my lectures. I lectured to many dentists and doctors and hospitals and so forth regarding how to have that high level of personal care. And so it was something we're very proud of, and we continue doing these lectures for other dentists, and many times they come to our office and they observe us, how we treat patients and so forth, and we go from there.
I want to get to some of your before and after shots here, so I'm going to turn this around so we can all take a good look at it and take a look at your first patient here. So this was her before. What was her problem when she came to see you?
Arlene, when she came and saw me, she was in her late 20s, and she basically had a fairly large spacing between the two centrals, or the two front teeth, and she had this supernumerary tooth, which is an extra tooth that had grown in between. And she had seen many dentists, and they had different recommendations for her, and they all were, you got to extract the tooth or have the tooth removed and then place an implant and so forth. And I was able to perform some cosmetic periodontal surgery, as well as some cosmetic recontouring of the teeth, use of porcelain veneers and so forth, and give her a very, very nice smile there.
Okay, so doctor, this is her after photo.
That's correct. And this created such a huge self-confidence. I mean, they boosted her self-confidence quite a bit. She was so excited. I mean, and she has moved on to a new position, new job, higher pay and so forth. So she was extremely happy.
All right, I'm going to get to the next photo here. There we go.
Sherry came to me after she had several dentists attempted to do some bonding procedures for her, but she was still very not happy with the way the smile was designed. So I recommended some porcelain veneers for her, and basically we broadened her smile. And we gave her more support for her lip, and the case turned out just beautiful.
Amazing. All right, the next patient here I think is Kim, right?
Right. Kim is, one of our patients that we use her photos quite a bit in our advertisings and so forth. She's such a beautiful lady.
She is.
When she came to me, she had really a perfectly nice set of teeth, but over the years she was into grinding. So she had grinded her teeth down, so her teeth were very short, and she wanted to show more teeth, a much more beautiful smile. So we did a full set of veneers for her, and it turned out to be something really exceptional. So
beautiful. Wow. Great smile. Well, she can't be unhappy with that, right?
Right.
All right, who's this guy?
Jim, again, he came to me. He had a lot of existing dental restorations, crowns and so forth, that they were just getting old, and they just, the smile needed some upgrading. So we basically went ahead and did a full mouth reconstruction for him, replaced his crowns and so forth, and again, he ended up with a very
great smile.
Nice set of beautiful smiles there.
Amazing. Dr. Nazeri, I do have to take a break. Now, coming up after the break, we're going to talk about dental implants and also mini dental implants that you do, right?
Okay. Yes.
Stay with us, everybody. Leading experts. We'll be right back.
I like to smile because I feel confident.
Very impressed, and from the time you walked in and June welcomes you and just everybody, it's just a wonderful feeling.
It's beautiful, it's comfortable. The staff greets you right away. You never have to wait to see the doctor. It's almost like the old type of country medicine, but with all the newest technology.
Bonding, veneering, teeth whitening, everyone is basically a candidate for teeth whitening. And even if there are patients that wear dentures, we can replace the teeth in the dentures and make them whiter and so forth. So cosmetic dentistry is a full range of different things that we could do for patients.